And today marked the final day to enroll for Affordable Care Act health insurance plans for the new year. Many, however, were caught with a case of sticker shock when they saw their premiums skyrocket.
Now, a local insurance company tells 3 News that while people are still renewing their plans, they've also seen a high number of cancellations, meaning many are deciding to go without coverage this year. Josh Maxwell has more.
I had one client that went from $1.58 to $2,100.
April Vasquez, who is a benefits consultant with McCran Insurance, describing the tough decisions clients are having to make as ACA premiums skyrocket. The reason?
Government and legislation that has caused and made all these changes. Also, when it comes to these plans, some of them are affordable, but unfortunately they are high deductible plans.
It's a reality many are having to navigate, including Michaela Pena, who is a cosmetologist. She says last year her premium with subsidies was $244 a month. Now the lowest she could find was for $300, and that doesn't even include her child.
I could maybe justify it if my child was added onto it, but because it was just for myself, I feel as though it's not really worth it.
Pena says that while the health of her child is important, so is the practicality of paying for care.
I almost feel like it's easier to pay out of pocket for certain things. This past year me and my boyfriend didn't even put our baby onto an insurance because we found that out-of-pocket costs were just easier if he was only going in for wellness checkups.
But Vasquez says the growing number of uninsured residents in the coastal bend could have a ripple effect on the local healthcare system.
So our prediction is that there will be an overflow of population in the hospitals this coming year due to the fact that they can't afford health insurance, but they need to be seen, whether it's minor or major.
Pena recommends families visit an insurance agent to decide what works best for them, but says at the end of the day, it's not a simple decision.
It's hard because you're kind of trying to figure out, like, where are we going to find the money for this? Where are we, or do we just go without? Is it easier to go without and then like get hit with a larger medical bill later on?
Josh Maxwell, 3 News.